Hi, my name is Bonnie Jackson, and I am a volunteer with ARP Arizona's Community Education Program. And we've been doing a series of short videos in regards to Medicare because it is open enrollment. And the focus today is going to be on Medicare Advantage. Medicare's open enrollment period is already here. It began on October 15th and will end December 7th of this year. I encourage you to check your mail for important notices from Medicare or Social Security regarding changes in coverage, costs, or service area. Also, review your 2022 Medicare and You Handbook. This is a wealth of information that can answer most of your questions without having to go to another resource. It does cover your Medicare coverage, your prescription drug plans that are available for your needs in 2022. And you need to remember, if you are happy with your current plan, there is absolutely nothing that you need to do to take any action. It will just continue as is. But if you do need some personalized help within your community, you may be able to find free information and events online or from Medicare counselors in your area by phone, like your state health insurance assistance program, which is run by the area agency on aging. Okay, our objective today is going to be to give you some basic information on Medicare Advantage. And the topics we will discuss are hospitalization, if you become an inpatient, medical care and durable equipment, and also prescription drug coverage. Let's take a look at hospitalization. To get covered by Part A hospitalization, you need to be admitted to the hospital. So, for example, if you go to the emergency room, they treat you there and then send you home, your hospitalization or Part A would not cover that. But if you are admitted, even for one night, then that coverage would start. But you need to be going to a doctor or a hospital within that network if you have a health managed organization or an HMO plan. Now, Medicare Advantage does offer a PPO plan as well, which is a preferred physician opportunity, and that would give you a greater range of doctors and hospitals that you can choose from. If you do go outside the network, you might pay a little bit more, but you would still have some coverage if you have a PPO. It would also cover your skilled nursing facility care, hospice care for end of life if you need it. This is actually covered by Medicare, original Medicare, and so they take care of it even if you're on a Medicare Advantage plan. And what is becoming much more popular these days is home health care, where you can stay in your home and have nurses come in and assist you. That would also be covered. There is no premium. It is the same as original. You paid for it when you were paying for your taxes. There is no deductible. Yes, there is a copayment. Now, if you're admitted into the hospital, your coverage would be X amount of dollars per day for a set number of days per episode. And basically, an episode would be once you're admitted to the hospital for a particular illness, you're treated, you're released, and then you go a period of time where you don't have to go back to the hospital. That would end the episode. But you need to read your policy and be very specific about what your needs or questions are, because the policies may vary. And there is no co-insurance with Medicare Advantage. Part B, medical care and equipment. This covers your doctor's visits, whether it be a regular doctor or a specialist. Once again, you need to go to doctors within your network. It would also cover outpatient care and durable medical equipment and preventative services like mammograms and sometimes the colonoscopies and things like that. What you also need to remember is that you're going to doctors that are in network, but if you're going to go to a specialist, you will need a referral from your primary doctor if you have an HMO plan. If you get the PPO plan, then you will no longer need that referral to go to a specialist. There is a premium. Last year's premium was $148.50 a month, much like it was just like the original. It is means tested though. If you have a pretty substantial income for retirement, you may be paying more per month, but that number is not set yet. So watch for notifications from Social Security and Medicare in regards to what that amount might be. If it may not change, we don't know yet. There is no deductible. There is a copayment. It is considerably less than the 20% you would pay for original, except in some cases. So if you have like a very kind of unique situation, you may want to clarify that with a representative from a policy that you're looking at to see what kinds of situations would mean that you might pay more than 20%. And there is no co-insurance. And it says it's asking you to read your policy carefully. And that's because there are some very unique and specific situations that might allow a co-insurance. So you might want to check that out with your agent as well. Prescription drugs, Part D. Now, this coverage is included in most Medicare Advantage plans, unless you choose one specifically where there is no Part D, and then you would have to purchase it separately. There's no premium, but it's means tested. Once again, if you have a pretty good income for retirement, you may have to pay a small premium. There are some policies will have a deductible, some, but most of them don't. But you want to read your policy and compare the plans. There is a copayment, and it depends on the drug tier. Another word of caution is that every insurance company, you want to verify that if you are on particular maintenance drugs, that your drug is covered with that insurance plan, and then look to see what tier they have it on. If it is a tier 4 drug, you're going to pay a higher copay. If it is a lower tier, like tier 1, it's usually a generic and it would cost less for your part. So you want to check that out to be sure. In terms of a co-insurance, in general, what you will be paying is a 25% copay for your medication until you reach the catastrophic level. But that is like $7,050. And at that point, anything over that, you would only pay 5% for your part of the coverage. But you need to read your policy once again, because they may vary a little. Now, there are lots of wonderful resources if you have more questions and you want specific answers for your situation. The State Health Insurance Assistance Program, SHIP, you can either go to their website at shiphelp.org, and then you just enter the state name, Arizona, and the information they're going to provide, it will be specific to our state. Or you can call 800-432-4040. I've already mentioned the Area Agency on Aging, Region 1. This is a very critical organization that can help in so many ways. And their number is 602-280-1059. And of course, Medicare itself at medicare.gov, or call 800-633-4227. And finally, Access is the Arizona, it's like our Medicaid program. So you could get information from them at health. Notice it has an E after that, healthyarizonaplus.gov, or call 1-855-432-7587. And ARP. We always have people that can give you good information if you go to arp.org/MedicareQA, or call 888-687-2277. Thank you very much for tuning in. I encourage you to look for our other videos because they're very informative. Thank you.